Okay, so hello everyone, wherever you are in the world. Welcome to the second series of the Nursing and Midwifery in Crisis webinars, which is a collection of Nursing Now Challenge webinars done in partnership with Jaya Mental Health. My name is João Marçal-Grilo. I'm a mental health nurse. That's my background. I'm usually based in the UK, and I'm also the founding director of Jaya Mental Health, as well as a proud Nursing Now Challenge champion. I'm joined by wonderful colleagues today from around the world. Some of these are part of the Nursing and Midwifery in Crisis Steering Committee. And everyone is here today really to explain what the second series of these webinars that focus on nursing and midwifery in crisis are all about. So these colleagues are Gila Zarbiv, who is a leading midwife for media affairs, midwifery promotion and international liaison for the Israeli Midwives Association. Gila will be exploring why we think that this topic of nursing and midwifery in crisis is important. She'll be followed by Chris Peskett, who's also a nurse and a board member of MSF, the Médecins Sans Frontières. Chris will be explaining what is it that we hope to achieve from series 2 of the Nursing and Midwifery in Crisis webinars. Chris will be followed by Rita Akiki. Rita has joined us in many of these webinars in the past. Rita is a nursing director of the Aboujaoude hospital in Lebanon. Rita will be moderating a discussion on a question that is really at the center of these webinars, which is what do nurses and midwives who work in crisis response need. In this discussion, Rita will be joined by other panelists, including Cecilia Lugungu, co-chair of Africa Regional Hub of the Challenges Committee in Kenya, also by Mohammed Ali Badir, who is a nurse working in the emergency department in Specialized Medical Center, all the way from Riyadh in Saudi Arabia, and by Dr. Siahirul Alim, who's a lecturer and researcher at the university's Gajah Mada in Indonesia. I also wanted to say hi to Andrea Latham and Kate Holmes, who are from the Nursing Now team. Her faces, we can't see her faces here at the moment, but they are in the background, and they are really the people who make these webinars possible. They make it happen. So hi to you as well. Very importantly, I think, about this particular webinar today and this second series is that we're really keen also to hear your voices. We really want to hear from you, your thoughts, your experiences, your ideas. So we've actually prepared a survey, which we'll be sharing with you throughout the webinar. You'll find the links on the chat box. And again, it's really to hear your thoughts on what's important to you around the topic of nursing and midwifery in crisis. This survey is done in 5 different languages: in French, in English, in Arabic, in Portuguese, and in Spanish. That's as far as we got in terms of languages. We wish we could have translated into 2 more languages, but let's see whether we can reach more people just for using these languages for the time being. And again, really important for you to take your time and fill these surveys, as we really want to hear your opinions. Before I give the floor to Gila, let me just do a really quick recap of what we did on series 1. So at the end of 2021, the Nursing Now Challenge launched a series of webinars under the theme Nursing and Midwifery in Crisis. And these webinars, there were 4 in total, examined the roles of nurses and midwives around the world in 3 different contexts of crisis. We covered war and conflict, natural disasters, and health crises. And in addition to exploring the role of health professionals in these types of crisis situations, the series encouraged discussions about the kind of available support that is out there to nurses and midwives working in emergency settings, with a particular focus on mental health and well-being. So this activity really brought together nurses and midwives from all parts of the world, really, as well as professionals with very different personal and professional backgrounds. So we heard about the experiences of nurses working in the Middle East, in the Caribbean, in Africa, in North America. We also heard from midwives and nurses that have put together resources and information that is of use to those working on the front line of these various different crises. And we were kind of offered glimpses of movements that are taking place around the globe, aimed at supporting nurses and midwives, physical and mental well-being during challenging times, acute for some, chronic for other, but challenging. So one of the main objectives of the Nursing and Midwifery in Crisis series was to create meaningful connections between health professionals, and that these webinars would be a platform that would unleash the power of bringing together colleagues from various different parts of the world, and giving people an opportunity to feel listened to and to feel connected. From the kind of informal feedback that we received from most panelists, as well from members of the audiences that watch those webinars, we think that hopefully they've served a purpose. Nevertheless, many questions remained unanswered, and there was a kind of a general sense that much more could be done to support nurses and midwives working under challenging circumstances. So the last 12 months have been incredibly tough for millions of people living and working in all areas of the world, and in countries like Yemen, Syria, the Horn of Africa, Sri Lanka, the Ukraine. And I think that in the past 3 days, areas like southern Turkey and northern Syria are in the midst of a terrible disaster on so many different levels. So Gila, on this note, why is this discussion important? So over to you, Gila.
Thank you so much. It is a distinct honor to be here, and welcome to everybody from around the world. I want to start by saying that my heart and my soul and my tears, my prayers go out to my neighbors in Syria and in Turkey, who are suffering on such a level that is hard to articulate, and it brings tears to my eyes as you watch people and children and infants and a newborn being pulled from the rubble and the catastrophe. And that's what this is about. That's what this is exactly about, why we're all here today, why all of you've come from all hours of the day, from all around the world to speak together, because when these catastrophes happen, it is a huge reminder that we need global cooperation and collaboration to be able to be there for each other, not just during, but before and after these catastrophes. And as you said so articulately, some are acute and some are chronic. My name is Gila Zarbiv. I'm from Jerusalem, Israel. I am a certified nurse midwife, a senior midwife working in a hospital in Hadassah and Karm in Jerusalem, in the city of Jerusalem. I sit on the board of the Israel Midwife Association as the chair of media, director of media affairs, and the international liaison for the ICM, which is the Global Midwife Association. And I'm a lecturer, an educator, a researcher, but most of all, a clinician at heart and in my soul for the women and their unborn children and born babies that we treat on a daily basis. We have been through so much the past few years, so much. All of us here have survived a global pandemic. We have been through multiple global catastrophes of earthquakes and weather-related events and human-related events such as war and famine and suffering. And we've also learned so much. And I think that one of the things that we've all experienced now and learned throughout these crises over the past few years is the crucial need for more conversation on a global level. I like to say that we need, when we ask, why is this important? Why are these webinars important? Why are we all here today? Because sometimes when we're in the midst of it, we forget that there are small solutions to very big problems. I recently had a meeting with I don't know if you know, twinning is when we work together through different countries to find solutions. So Israel has been dealing with creating, or struggling like the rest of the world, with midwifery, autonomy, and independence, and creating midwifery-led continuity of care. We recently had a meeting with another organization in a very developed country where there is midwifery continuity of care to get from them information on how to accomplish and implement some of our ideas. You'd be shocked to know which country it was. When they found out our struggles, they responded, we're struggling with the same things in our country where these concepts are implemented and established. Let's work together. That was a conversation between midwives to midwives on big problems, and we started to develop simple solutions. What's an example of a simple solution that we could all do here today? A WhatsApp group between countries to discuss issues that we can have before the event, things that people are struggling with regards to education or planning or promotion of our own fields. All of us across the world are struggling with nursing and midwifery, independence and autonomy and scope of practice. This is a global issue. If all of us stood up today, worked together to promote and change these issues, we could probably feel that change in a matter of minutes or days. But in order to accomplish that, we would need to work together on a global level. In order to work together, we need to talk, we need to communicate, we need to hear from you. We want to hear from you. What are your issues, be them chronic or acute? What are you struggling with? What can we as a global community do to assist you on a small level or on a larger level? And in order to begin to find those solutions, we need to first hear the problems and begin to implement small solutions for really big problems. It's an honor to be here. I would love to speak to anyone at the end or questions or comments, and I look forward to hearing from the rest of the panelists. Thank you all so much.
Gila, thank you very much. I mean, I have to say, Gila, and you know, we've been together now on a couple of webinars. I absolutely love the way, the raw, passionate, emotional way that you talk about what you believe in. And, you know, you were talking about fundamental human values, I think. You know, what, you know, we're in a world, and I think we talked about this, even we touched this in the last webinar, that people are so focused on looking at our differences and forget about looking at our similarities, and communicate with one another. And this is really what it's all about, isn't it? It's about us communicating, sharing, listening, being, you know, providing constructive criticism. That's really what this is all about, isn't it? At its kind of most basic level. But you know, I really wanted to say that to you. And another thing that you've mentioned, I think it's very important. When thinking about the nursing and midwifery in crisis, or thinking about how do we answer the question, what kind of needs are there and how can we respond to those needs? We need to think about the before and the after as well, and not just the crisis in itself, because of the nature of crisis, which is so varied. And I think, Chris, passing on the word to you, one of the things that you're going to talk about is the term crisis, that we tend to focus on one specific type of scenarios, and yet it's a word that it's quite broad in its sense, isn't it? So over to you, Chris.
Okay, so thank you for that, Joanne, and thank you for all of you here. And I'm watching the numbers going up, and it's great to see so many people from so many countries. This is a truly international webinar, and this is what it's all about, bringing us together. And I think it's really important of Joanne and Gila to mention this terrible tragedy that's happened in Turkey and in Syria. The enormity of it will be unfolding in the days and weeks ahead. Thousands have been killed, probably tens of thousands of people injured, And I think I don't need to say that all our colleague nurses and midwives there in Turkey and Syria in these affected areas have stepped up straight away. Many will have been off duty that have jumped in straight away to do what they can to help the suffering populations there, working long hours, extremely challenging. I mean, it's sometimes difficult just to imagine. We can't imagine what it's like unless we've actually been in a situation like it. But just imagine the pain, the fear of the patients who've been badly injured, the crying, the screaming, the anguish of the relatives, the blood, the overwhelmed accident units, the overwhelmed admission wards. I mean, it's truly terrible, but our colleagues, our colleague midwives and nurses are there doing everything they can, just getting on with the work. And Syria, I know a lot about Syria because of my organization, MSF, Médecins Sans Frontières, has been working there in the conflict for many years. Not only are our colleagues in Syria having to deal with this awful tragedy, but they're doing so in a situation of great insecurity. Even getting to work or going home can be dangerous. As I don't need to tell you, you all know that health centres are being targeted so many times, so many health staff are being killed, so many have fled. They're so lacking in such basic resources, but still they're doing what they can to bring immediate care to those who so desperately need it now. But you don't have to be in a natural disaster. You don't have to be in a crisis, as João has mentioned, to know what a crisis means for nursing. There are so many aspects to crises in nursing at the moment. I mean, I have been privileged with MSF to work in various countries, and wherever I've worked, I've seen the difficulties of nurses and midwives giving quality care because they don't have basic equipment. Yeah, the sphygmomanometer is not working, the beds don't function, the mattresses are torn and bloody. Maybe there's no electricity. At night, there's no light, so you have to use a torch to go around. There's no electricity for oxygen concentrators. Maybe there's inadequate water. Also, I mean, in many places, nurses and midwives haven't been paid for weeks or months because of the economic or the political situation in their countries, but still, they come to work, even though thinking about the stress of having to provide for their families, they're still coming every day or every night to look after patients. And then, of course, in many areas, there aren't enough nurses and midwives to do the work to the level of quality that we want to do. And on this, Cecilia will be talking about her own experience in Kenya. And what about educational resources? I'm in the United Kingdom. If I want to look at the latest research, nursing practice, I just click on my computer, I'm on the internet, or I can go into a bookshop or a library, I get up-to-date books. Still in 2023, in many countries, that's not possible for many people. On this, we look forward to hearing what Dr. Sia Hodel is going to say about accessing research and information. And then more generally, how are nurses and midwives viewed? Well, from my experience in many countries, unfortunately, we're not given the full respect that our professions demand. In the medical hierarchy, we're not given that equal status with doctors, maybe laboratory technicians, physiotherapists, but we're all in a team working together. And so often I've seen nurses not listened to. I mean, they have solutions. We're talking about solutions today. They see problems, they have ideas, they want to help, but often they're ignored or just told to be quiet and get on with their job as nurses and midwives. And how can you have satisfaction? How can you have enjoyment in your work if you're not an equal in your team with your colleagues? And then what about respect because of gender? I'm a male, yeah, I have a privileged position, I feel, but so many nurses are females and they work in male-dominated environments where, again, they're not listened to. And beyond that, I also know that many nurses in some of the countries I've worked in, they're doing their best to help male patients, but because of doing that, they're looked down upon by not only the patients, but society. They're somehow seen as not good people, and this is a terrible thing. And going one step further, Afghanistan, as I'm sure you all know, nurses and midwives can no longer work for international organizations. Just think about the enormity, the morbidity and the mortality that's now resulting because of that. And just think about our colleagues who can't work, they can't do what they love doing. I mean, this is terrible and it's happening. And then what about nurses and midwives who were looked down upon, disrespected, abused racially just because of who they are, because of their ethnic background, yeah, the language they speak, the religion that they belong to? All these things are going on now. And further, I mean, I've worked in accident departments. I know the violence that can be given to nurses, the abuse by confused, frightened, angry patients, patients on drugs. It doesn't have to be in an accident department, it can be anywhere. I'm sure we've all faced violence and insults. Yeah? And so clearly, there is a strong need for support for mental well-being for nurses and midwives. I mean, we have to deal with so much. And on this, I look forward to hearing what Mohammed will be saying. Yeah, because we need answers, we need help. And in so many countries, it's difficult, I think, for nurses and midwives to talk to their family. There's often a culture of not talking about what you go through at work. There's no professional support. The official attitude is simply, this is your job, get on and do it. Yeah, there's nothing more to be done, but there's a lot more to be done. And that's what we're going to be looking at today. Indeed, today, there's so much to talk about, and I think I need to start winding up now. So much to talk about and think about, but the important thing is the survey that João has touched on. That survey is really important. I've given my views, my perspectives. We need to hear all of your views, because when we can get your feedback, we can start analysing together, and we can start looking at solutions. There won't be one solution for all people. Yeah, we have to adjust solutions for different countries, different contexts. But the important thing is, all of us are here together now to support ourselves and find solutions to make our environments better for ourselves and for our patients. And so I think I've spoken more than I should have done, but now thank you for your attention. And now handing back to João.
Chris, you did not talk too much. You know, we could hear you for hours and hours and hours. You were touching on so many important things. You know, on one hand, the resilience of nurses and midwives working in particular parts of the world, but then the enormity of the challenges and the variety of challenges that the workforce is facing. And you're absolutely right. I think one of the things that, you know, and we will be kind of repeating this over and over again, one of the things that we would really love to be able to achieve today is to get as many as of you completing these surveys, because you're the ones who have, you know, the answers to so many of the questions that we're hoping to respond to. I mean, I was just thinking as you were talking, Chris, of, for example, the amount of nurses and midwives that would not even be able to join us in this session because they won't have the laptop, because there is no internet, because so just by thinking of that, how many people are excluded from what we're doing here today because they can't, because there is no internet, because there is no computer, because there, so, you know, the more people that you can also, your colleagues, you can share these forms with, the ones that are coming up on the chat room, especially if you think that, you know, people who, for example, don't speak English but will speak French or any other of the languages that have been translated, please do share those forms with everyone, because the more answers we have, the better. So Rita, now over to you. You're going to chair a discussion that's very much along the lines of what we're talking about now. So over to you, Rita.
Thank you, Jaya, and thank you everyone who joined us today. I'm Rita, a registered nurse from Lebanon, and I'm very proud to be with all of you and to share our thoughts today. As you all know, we are living in a world that is facing all sorts of emergencies. As Chris said before, we need to step up. We need to support nurses and midwives working in areas that are affected by crisis and all types of crises, and where health inequalities are also very marked. So what do nurses and midwives working in those crisis-affected areas and responding to crisis needs really? We are going to discuss and to elaborate answers with all our panelists, and we are going to put it in practice, we hope so. Despite all challenges, nurses and midwives are responding and serving their communities every day with advocacy. And of course, there are like practices and delivering cares across affected areas. Disasters and poverty are nowadays a very huge problem. Also, you know, we are in lack of resources all over the world, especially after COVID-19 pandemic. Also, delivering care in crisis is a unique challenge in itself. So nurses are in high pressure, high mortality rates, there is affection of their mental health and also their psychological well-being. And sometimes we have nurses that are depressed. So we are asking ourselves how a depressed nurse can serve a patient or even a community. Also, nurses may not focus on their own interests. Nurses always focus on others. They prioritize others. But now it is time, it's a call to all nurses and midwives to be more present for ourselves, to have a sympathetical presence and to think what really matters for us, really as nurses and midwives. It is not sufficient to be resilient and to support the crisis and to go across the crisis. However, the limits for endurance are here. We cannot be always like heroes and applause heroes. Nurses need also help. We need to rebuild a strong profession. We need to have strongest nurses and midwives. We need to build culture of wellness for nurses. And of course, we need to build a person-centered care system, not just a patient care system. So a healthy work environment is a minimum right for each healthcare worker, not just nurses and midwives. So we need strategies that must encourage nurses, midwives, also early career nurses and midwives to be engaged in solutions and decision making. And here comes the role of each one of you that are present here, really to feel free to share with us in the chat box your thoughts, your stories, and even to fulfill this questionnaire that is translated in all the language that we know and we can share with you. So it is not optional, it is must, it is urgent nowadays, it is a fact that there is no health without mental health. And now, as usual, we have the really amazing group of panelists that is joining us today. We will be hearing experiences from nurses and midwives that are working in areas affected by crisis or even whose work is related to crisis area. So first of all, we are going to hear from Cecilia Ndungu. She's from Kenya and she's co-chair of Africa Regional Hub Challenger Committee. So up to you, Cecilia, the floor is yours.
Thank you so much, Rita. My name is Cecilia Ndungu. I am a clinical nurse in Kenya, and I'm also the co-chair of Nursing Now Challenge. In Africa, we have been faced with so many challenges and crises. We have had war-torn areas with terrorist attacks. We have had remote areas with poor infrastructure. Like we have some people who cannot be able to join us during this webinar because of power shortages. There is no connectivity of internet. And then there's also areas with gender-based violence, whereby our nurses and midwives are supposed to work in and provide their services. And we also have lockdown areas, whereby they have insecurities, especially in the pastoral areas. These places have been faced with a lot of challenges. And we also have some cultural practices that hinder the nurses and the midwives to be able to perform their duties. So as Nursing Now Challenge, we have a role to help create an environment that will increase productivity and lead to the well-being of our nurses. And this is by fostering a positive work culture. This is by encouraging an open communication, encouraging teamwork and supportive work environment, which can create a positive workplace culture and then promote the well-being of our nurses. And we can also enhance access to resources. We find that most of the health facilities, they have shortages of resources. That is the equipment, the medicines, and also shortages of nurses. This is the current crisis that we are having in Africa. And the countries are able to train their young workforce, but they're not able to fully absorb or to fully employ the workforce. That's why we are finding most of them are seeking for greener pastures in Western countries. And that is one of the current issues that International Council of Nurses is trying to come with a solution. We also need to support effectively the mental health of our nurses. This is something that needs to be highly enforced. It doesn't have to be big or small, but the psychosocial support of our healthcare workers is very, very crucial. And thanks to the Kenyan National Nurses of Kenya, they have been able to support their nurses by setting up a call center, a healthcare workforce for the healthcare workforce. And this call center is able to respond to psychosocial support of all the healthcare workers, including also their families, because if a healthcare workforce is really affected, the family as a whole is also affected. We also need to advocate for better working conditions and fair compensation. This goes hand in hand with the brain drain. If we cannot be able to fairly reward the workforce, they will be faced with burnout, and it will reduce the job satisfaction, which we really need to be able to attain for universal health care. We also need to promote professional development and continuous learning. And this has highly been embraced by Nursing Now challenges by providing the leadership courses, providing various types of courses that nurses, the young nurses and midwives are able to take for continuous development, and they're able to enhance their development as a profession. And also something else, we need also to encourage the work-life balance. It's not about work, work, work. We also need to have a social environment and a family environment that is able to embrace you as a nurse, as a midwife, to better provide your care and service to your clients and your patients. And also the major thing that is very, very important but very underrated is the recognizing and rewarding the effort of these workers. We need to reward regardless of whether it is small or big. And thanks to Nursing Now Challenge, it has been able to reward their nurses during the International Nurses Week. And we've also had one of my colleagues got an award. I also got an award to recognize what people are doing. And that way it is able to motivate and boost the mental health of these care workers. Thank you so much. Back to you.
Thank you, Cecilia, for your amazing input. And as you said, it is very important to have this work environment and this solidarity between not just nurses, but all the community around the nurses. Everybody needs to feel that he is not alone, that we are like in dialogue all with others, and that we can feel this kind of family in our work, in our community. And of course, the continuing education is very important to build capacity, not just competency and performance. We need to build the leadership of each one of us, because we need this resilience to go beyond the situation, and we need to be able to continue our work. And this work balance with the life is very important also, as you mentioned. And now we are going to go to Muhammad Ali Bdair. He is a registered nurse working at emergency department in Saudi Arabia. And we are going to hear from you, Muhammad.
Thank you so much, Rita, for the introduction. My name is Muhammad Ali. I'm a registered nurse in the emergency department in one of the biggest hospitals in Riyadh. To me, crisis means everything. I have been in 3 main crises back in Lebanon. The first crisis, obviously, is the COVID-19, where patients had to stay in the ER intubated, and we had to take care of them with limited resources, of course. The second one was the economic crisis, where our salaries as registered nurses went down drastically. We reached to $100 per month for one RN. And we were nagging, we were complaining, and no one really heard us. Now, the third and the most important crisis that we went through in Lebanon was, of course, the 2020 Beirut blast. It was disastrous, catastrophic. And I've always talked about the Beirut blast during the Nursing Now webinars. We've seen a lot of people dead, people searching for their loved ones, and we could save a lot of people, and we didn't save a lot of people, and we had to live with our lives after that. Now, for me, I would like to say a lot of stuff about the crisis management and how to take care of our nurses and midwives. But the problem is that most of the attendees here are on the front line and are bedside nurses. What we really need to address, we need to address the administration. The people who are supposed to take care of nurses are supposed to take care of the bedside. And one really concept that comes to mind is moral injury. So what is moral injury? It's because we as nurses, as midwives, we went into this profession with an evangelical soul that we want to help out others, that we need to help everyone around us. So you might hear that, oh, we're underpaid, but if you get a $10,000 per month and you're supposed to take care of more than you can handle, what will happen to you? So basically, money doesn't really replace your mental health, doesn't really replace even your physical health. And I've been through this because, as mentioned before, I had a cardiac arrest due to me not being able to sleep, due to me having a lot of stress during my job. And thank God I was on duty, and thank God that my friends and my coworkers rescued me from that fatal situation. So basically what I'm saying is, the administration needs to tackle moral injury. And we've heard a lot of people, a lot of healthcare providers committing suicide due to that problem. So what we have to do now for the attendees that we have to do from the healthcare workers, fill out the survey, because this will help you and will help the rest of the healthcare team. We have to do something about it, and we have to do it now. Thank you so much.
Thank you so much, Muhammad, for your sharing and for sharing your story, your own story. This is very touchable. And as you mentioned about Lebanon and Beirut blast, you know, in this Sunday, there was this earthquake in Turkey. And here in Lebanon, we have lived like a small seconds of this earthquake. And when I arrived on Monday morning at my hospital, one of my colleagues told me, you know, Rita, I was very afraid because this reminds me Beirut blast. I closed my eyes, I closed my ears. I thought this is another explosion. Yes, moral injuries are very important, and it is not just related to crisis, as you mentioned, Muhammad. It is sometimes related to our work, because sometimes there is not this teamwork. Sometimes we are overwhelmed by the number of patients here in Lebanon and in other countries that are struggled with shortage in nurses. We are living this problem. And yes, this is through this kind of raising voice that we can all together raise our voice as nurses, as midwives, and as international community, and go through policy and even to politicians to change all kinds of daily management they are doing, not just at small level, but of course at country and even at the world level. And of course, to change all this, we need evidence-based practice. We need research to be built on. Policies cannot be changed if we do not have proofs. So we are going to go to Dr. Zahirul Alim, lecturer and researcher from the University of Gajah Mada in Indonesia. It's to you. The floor is yours, Dr. Alim.
Okay, thank you so much, Rita. Hello, everyone. Yeah, greetings from Yogyakarta, Indonesia. And thank you so much for having me on this very useful webinar, I believe. And my deepest condolences as well for the victims of the Turkey and Syrian earthquake. It reminds me a lot with our conditions back to 2006. We had a big earthquake at that time. Actually, if I can get more time, I will explain more regarding the lesson learned that we had during the crisis at that time. Yeah, and it's almost the same, the condition with our situation in 2006. At that time, we had very early in the morning earthquake, actually 5:53 a.m. in the morning. And this lesson learned, actually, I already write down our experience to deal with this condition on the book chapter, on the book titled The Role of Nurses in Disaster Management in Asia Pacific. It's published by Springer. I was one of the book chapter authors. And yes, at that time, we had a very critical situation, because I didn't know that, in 2005, we had a big tsunami in Aceh. And I think all of you remember that it was a very, very big earthquake and tsunami at that time. We had total casualties. More than 500,000 people died during after the tsunami. And I was the one of the volunteers as well for 2 weeks there as nurses. And yes, for my 20 years experience as lecturers, I've been through many experience in the natural disaster, especially here, because in Indonesia we had lots of hazards. We called the geographical area as the Ring of Fire, because many volcanoes. Even in our city here in Yogyakarta, we have one Merapi volcano. It's actively volcano. And then related to the research about the disaster itself, we are, as nurses and midwives, actually we have all the strengths. For example, we have nurses and midwives are team players. We work actively, effectively, and interdisciplinary teams. And this strength, it will be very benefit and needed during the disaster situation. And the second of our strength is that nurses and midwives have been advocates for primary, secondary, and tertiary prevention, which means that nurses and midwives can play the key roles at the forefront, I mean, in disaster prevention, mitigation, preparedness, response, recovery, and evaluation. Regarding this, actually, now I've been working with my students, for my bachelor students, my master students, and my doctoral students, how we can put all the concept and the theory into the practice, how we can put that into the practice, and the community will get the benefit from our, from our concept and theory, and that what we can learn from our experience. And the third, for our strength, is actually nurses and midwives historically integrate the psychological, social support, and family-oriented aspect of care with that's physiological need of patients and clients. During the disaster situation, the crisis situation, I believe that we all nurses, we could work, that we could put all the efforts, even the, during the 2006 earthquake. I've been working very close with the staff and nursing students in our buildings, in our campus. We were doing the treatment for more than 100 patients at that time, and we worked very hard to do that. And I even stay in the campus at the time, not going back at home and doing something, but my focus is only how we can help for each other. And the last strength that I believe that nurses and midwives are available and practicing across the spectrum of healthcare delivery system. This is our strength and can be mobilized. Here, I'm also the head of department in the emergency and basic nursing, and also the head of the Nursing Association for the disaster management in the Yogyakarta. And I believe that if we could work effectively, if we could work with a good organization, will be very useful, purposeful. I learned a lot with, I did my master and my PhD in Kobe University, Japan, and I learned a lot that how we can manage a disaster from Japan. And since Indonesia, we have, as I mentioned, many hazards, specifically for natural hazards. That's why, and I would like to hope that our country, we will have a laboratory for disaster health care management. So yeah, that's actually our strength as nurses and midwives. So if we talk about how we can handle the principles in disaster-related research, we must understand that if we do the research in disaster-related topic, it will be the first one is purposeful and outcomes drives. It means that we have to understand that what we do in the project. That's what I talk to my students. If they will do the research, what is the purpose for the project? And then the second is we intend to change, to improve the outcomes of care in disaster situations. How we can improve the outcomes of care. So now I think the conditions are much better during the 2 decades. Yeah. Almost 2 decades after the tsunami in Aceh in 2005. I'm sorry, 2004, I believe, in the end of 2004, because I volunteered in January of 2005. So at that time in Indonesia, in our country, we didn't have any such organization who work into the how we can manage the disaster at that time. And then gradually our government improved the management in disaster, and I believe now it's getting better and better and better. And even in the university, we are working hard and working closely with the disaster management authority. how we can find solutions, or how we can find good or best experience, best practice to the community. And the third one, for the principles in disaster-related research, that we have to understand to involve collaboration, not only one profession, but we have to work with the multidisciplinary setting. Yeah. And then the last is how we can achieve the improved outcomes. So in the way that we have to think a lot about how we can put one project, and then we can evaluate into yearly, not only do the one research project in the community and then we leave it, but we have to deal with this kind of activity, and then we follow by years, even if we need to follow this project in 10 years. So it means that we will have a very good data for the longitudinal research. So, and I believe if we could do this kind of things, we can improve many things. And the purpose will be the community, not us as you know, as healthcare workers, but what we can do for the community. That's why in the term of the disaster management, we'll put it disaster management community-based or community-based disaster management. I believe that if we could work closely and we could work together, multidisciplinary, and then we can have a just like this webinar, we can have a networking globally. So it will be very good, I believe so. Well, thank you so much. Yeah, if you have any question, please do so. Thank you.
Thank you so much, Dr. Alim, especially for this amazing highlight on the capacity of nurses that are able to work in a multidisciplinary team, and also to highlight the strengths of nurses that are working in areas that are affected by crisis or even with lack of resources. I'm just wondering, with a few seconds that we still have, if you could, Dr. Alim, tell us how, based on the research and all the open resources that we have, how can nurses, midwives working in crisis affected area, and as mentioned before, with lack of internet, sometimes lack of even a computer, access to those valuable researchers? What could be your advice to those nurses to access to those resources and be able to use those information usefully?
Well, thank you so much for the questions. Actually, if we would like, or if we eager to learn about the disaster, if we have a limitation for the resources, we can do. I believe the closest one is the how we can get the information from the reliable resource, such as the government authority. And then the disaster management authority and the university. So now because according to the SFDRR, Sendai Framework for Disaster Risk Reduction 2015-2030, we need how we can educate the community how to understand the risk, the disaster risk for the people. It's you know, somehow that's the important thing. It's how the people understand. They live in the area that you know, the risk of disaster or the hazards are happen there. Yeah.
Thank you so much, Dr. Alim. And for everyone, please feel free to share your stories in the chat box. And now we go back to you, Jawa, and thank you for all the panelists.
Yes, thank you very much. There's so many different, thank you, Rita. There's so many different things, you know, I was thinking, oh, we need another webinar for this one and for this one and for this one, all sort of topics that they're all kind of linked together, don't they? But in a way, some of them, I mean, Cecilia, for example, you were mentioning about brain drainage. I think that's a huge, such an important topic, because it's what happens in the countries where nurses are leaving, but also the countries where they are taking those nurses from. You know, there's issues there, as in the part of the world that I'm in, that we're also not addressing, and creating these really unfair, really unbalanced dynamics, which is it's definitely not a win-win situation for anyone. So it was interesting to know how many topics that there are for us to talk about. I think, you know, and kind of going back to series 1 and now thinking of series 2, and we've started by saying there's a lot of use in kind of sharing the stories and having a platform for us to vent and to learn from each other, from the experiences that we have as health professionals, our own personal experiences. But now I think we also are at the stage that we really want to look, okay, what are the real obstacles here? What can we do? Let's think practically, whether there are, like you said, Gila, at the beginning, small solutions to very big problems, but we are resilient. We are, you know, networking together. So are there good things that could come out of this that we could put into practice? And above all, and I think that's for me at least, it's one of the main questions of today's webinar, hence why it's so important to fill the form and to spread the form. How can we reach out to those nurses and midwives who are not necessarily going to be able to join forums like this one, who are not going to be able to connect to the internet, who are going to be in world areas where, you know, they are isolated for all sorts of reasons? That it would be one of our main questions. So we're thinking about resources that we want to develop, and hopefully they will be useful for everyone, but is everyone going to be able to reach them, those resources? So for me, that's if we had, you know, people's experiences and potential solutions to reach out to those colleagues, that, you know, if we are able to have some answers and some ideas based on the survey or even future webinars, that's already an achievement, I think, from this webinar. So again, extremely repetitive, but if you can share the surveys, do. If you are in a world area where you know that some of your colleagues will not be able to fill this Google form, how can we reach out to them? How can we ask them questions and make sure that their voices are also heard? I don't have an answer for that, but hopefully some of you do. So our hope really is to hear your voices now. Tell us what you think, and we'll get together again once we have those answers, once we've heard from you, and hopefully we can start all together, start thinking constructively, how can we find some solutions to overcome these obstacles? Sorry, I just talk, and probably everyone else will say something. I'm just looking at the watch, thinking it's almost 4 o'clock. And anyone, any questions, from both everybody that's listening to us and from the panelists, anyone that wants to say something before we leave? No?
Well, thank you, Jaya. I would like to highlight the call of Gila at the beginning for a WhatsApp group. That would be very important, especially when people are in lack with internet and access to devices. So because everybody nowadays has WhatsApp and can use it. And also, I think we can maybe have a group to join and have like recorded sessions on mental well-being and supportive exercises, breathing exercises or something like that. That could be shared and translated in others' language. So that could be helpful for other persons that are in lack to join us in live webinars. Thank you.
Absolutely, and I think that's, you know, a good example, Gila, Rita, the kind of solutions that we are thinking to overcome this challenge, which hopefully we'll be able to overcome. And I think that that's the spirit, isn't it? Is to keep positive and thinking that together, as cliche as that might sound, we can achieve a lot. And that's really why these platforms are important. Okay, I think we've just passed 4 o'clock. Well, in the UK, I'm not, but probably kind of later where many of you are. We still don't have a date for the next webinar. I think what we need to do now, again, is to collect your stories, but hopefully we'll come back to you soon to share with everyone what you have told us, and to move that step kind of further of starting to think of, the possibilities that are out there for us to explore in terms of creating, of answering really the questions that we've been asking ourselves in terms of how do we respond to the needs of our colleagues, of everyone that works in areas of crisis. Okay, so lovely to see everyone. Really look forward to seeing you all again soon. And until next time.
Okay, thank you.